Oh no, good morning, everybody.
Good morning.
I'm really happy to hear, when they told me to give the basic immunology at 8:30 in the morning, I was like, what a great topic to do when you're like a little sleepy there. So I hope you're drinking your coffee, and I'll try to make this as painless as possible, all right? Sometimes when I come to these things with a podium, I feel like I need a box to stand up, because I'm so small. So today's objectives, I'm just gonna go over a little bit about the history and the origins of immunology, very high-level overview, and then talk a little bit more about the immune system in a little more detail, and then tie that to autoimmune diseases. So before I go into any in-depth, I just for you to sit back and think about what is immune system to you? When you go out and talk to the healthcare providers, the things that they talk to you about, whatever disease or any ailments that you may have, or a loved one that may have, do they ever talk to you about immunology, your immune system is something that's causing the disease that the person is affected? Do you ever think about it? Do you ever feel like, what are they talking about? And you just or you're reading articles online and they have all these terms that throw at you and just like, what is that? Well, just to think about that. So what I want to provide you is a high-level overview to get you more informed so that when you're out there, you can have the tools needed to understand and ask the right questions, all right? But it's very interesting to go through the origin. So the word immunity comes from Latin, from the word immunis. It means exempt free from burden and exempt from taxes. Nothing to do with biology, right? You're just like, what? Taxes. But if you watch Law and Order like me, you always hear about immunity. So the word immunity can be used in many different disciplines. In a legal discipline, it essentially means freedom from liability, taxation, or jurisdiction. You always say, you're immune for this, grant me immunity. But in biology, essentially it's just resistant or fighting infections and foreign microorganisms. But the word immunis, just think of immunis from Latin. So everything comes from Latin, a lot of these medical terms. But let's talk about the origins of immunology. We didn't know about immunology back then, but if you look at some of the chronicles from the philosophers in 400 BC, they wrote about the plague. And what they noticed is that nurses who have contracted the plague, they can actually, and the ones that survive, they can actually take care of patients that have plague without getting sick the second time. And they're like, what is going on? But they didn't understand it was your body, your immune system fighting or getting resistance to it. So they didn't understand very much. But it was the mid-15th century that the Chinese and the Turks, what they did is they did what's called inoculation. So the picture here is the hand of a patient with smallpox. So what they'll do, they'll cut off the smallpox and they'll crush it into pieces, and they'll give it to healthy individuals to inhale it. Or what they'll do is they take the healthy individuals, they cut incisions in the skin and deposit smallpox into it. So that's called inoculation. So it's a way to develop resistance. So they got that from some of the chronicles I read about. Of course, it seems to a good idea. We know smallpox is very contagious. For those that had good immune system, they were able to fight it, but there were a lot of deaths that came about. But the word viralization, which essentially means introduction of live microorganisms, pathogens to the individual, was not coined until 1775, where they used essentially live smallpox and they would just deposit it into people. So at that time, a lot of surgeons made a lot of money out of that because it was the only way to do it. But it was not always successful. So there were a lot of deaths that were associated with it. So this is I love history. So Edward Jenner is a scientist, and this is the very interesting part about it. When he was a child, he was very related with smallpox. So the way they do it back then with the children is they will introduce smallpox to the children, and then they'll lock them all in the room, and then they give them very limited food, and whoever survives gets out. So it's like, what? So when you read the story, it's interesting. So he wasn't one of the survived, but he remembered it was really painful process for him. So what he did is in 1798, he became a scientist and a physician, and he had a milkmaid that came to see him. So essentially the milkmaid had hand lesions, very similar to smallpox. But the only thing that happened to the milkmaid was she got a little fever, but she wasn't completely sick. She didn't die from it. So the milkmaid said, yeah, I work with cows, and at that time there was something called cowpox at that time. So the milkmaid was fine, she's like, I just get a little sick, but it goes away. So what he did is he took lesions from her skin, and what he did was he took the son of his gardener without permission, and he inoculated the child with cowpox. So the child got sick for a few days, but he was fine. And then the next thing that he did was put smallpox into the child. So if you think about it, it's like, what is so unethical? But it's crazy. But what he realized that when the child was survived from the cowpox and he given him smallpox, the child didn't die. He was fine, it was nothing. So that's why he came with vaccination. Vaccination comes from the word vaca, because cow in Latin Spanish. That's why vaccine. That's why we call it vaccine, all right? And it's like, wow, what are they doing back then, right? But Edward Jenner was not the father of immunology, it was Pasteur, Louis Pasteur. We hear about pasteurization, milk pasteurization. The reason he's the father of immunology is because in the 1800s, he found ways to prevent and minimize disease spread. And he came up with fermentation, vaccination, and pasteurization. And he's the first one that came up with vaccinations against bacteria. All the vaccines that were developed earlier were against viruses, but he came up with the first one for bacteria, which is tuberculosis. And he showed that one of the interesting things is that he did treat a 9-year-old boy named Joseph Meister, who was bitten by a rabid dog, and he helped this child. So this child was so touched by how he saved his life that when he grew up, he became the gatekeeper of what's called the Pasteur Institute. It's one of the most prestigious research facilities in France. And this is just, I have a lot of useless information I share with you, but the reason I want to talk about this is really interesting because he was so touched by it as a gatekeeper. In 1940s, when the Germans came in to occupy, they wanted Joseph Meister to open the Pasteur Institute, open the crypts, because they wanted to destroy it. Joseph Meister, he didn't want to open it. So rather than open it to the Germans, he committed suicide. So it's very interesting. So Pasteur did touch a lot of lives at that time, too. So the new field of study came about, even later in mid-century, the immunology, study of immunology came about in the mid-20th century. It became very prominent in 1950 in Boston, where they did the first transplant, kidney transplant, from a twin to the other. And the patient was able to survive without any other drug, so they did really well. All the transplants they've done before, there's one that they did in 1909, where they transplanted a rabbit kidney into a child. And the child was good for 3 days, but died 2 weeks later, so they didn't know. But the first success was in 1950. That's when we go, there's something about twins, about immunology that need to have some similarity in order for it to work. But this thing, immunology didn't really pick up until 1980s with the emergence of AIDS, the acquired immunodeficiency syndrome. We remember that time when HIV was full-blown. That's when we really need to take a look at this. So essentially, HIV is the one that built the foundation for the study of immunology. In this case. So here we go. So based on all this information, we know the role of the immune system has many facets to it. So we know very well it fights against infections. So that's the main thing that we think about immunology. But your immune system is very important to fight tumor growth internally. So people who have cancer or develop tumors, there's also something wrong, something that's happened like haywire in their immune system. And it also functions tissue repair and clearance. So let's, for example, when you get an injury and you get scar tissue, that's usually another effect of your immune system not being able to clear some of the dead tissues away. Our cells we do have a turnover in the cells. Our cells that we have, they die off every few days or 10 days, and they need to be cleared of the system to produce new cells. So when you don't have good clearance, you can have problems as well. But as good as immune system, something that's good can be bad for you as well when you have too much of it. The challenges of the immune system is that it imposes barrier for some of the life-saving techniques such as transplantation that's really needed. As much as we help out with transplantations, like for example, if you look at heart transplants, they do develop problems, complications 20 years later as well. So it's not 100% proof in terms of what we understand. And of course, allergies, I have allergies, seasonal allergies, that's also part of the immune system. And it kind of affects our daily lives, correct? There are two aspects of the immune system, so bear with me here. This is the interesting part, maybe. So there are two aspects. It's innate, there's something called innate immune system and acquired. Just think about these two, innate. And I'm gonna tell you the difference between the two. So the first one is talking about innate. The innate immune system is something that you're born with. It's the first thing that kicks in. It's the first line of defense, it's fast acting. It's everything that you have at the beginning to fight anything that's foreign to you, all right? So what do I mean by that? So they have what's called physical barriers. So it can be the skin, the saliva, tears, because in the saliva, tears were enzymes that fight the microbes. The lining of the stomach to fight the microbes when you ingest something that could have some sort of bacteria that's harmful. So it's there to fight it. So that's the physical barrier, like mucus, from your nose. That's also to fight bacteria. So that's the first line of defense. You're born with that, And then there's a physical barrier. There's also the cellular barrier. So what if these microbes get past that first barrier? So it gets to your second barrier. And this is still part of your innate immune system. It comes from your mother. It's passed on from your mother to the child, first line. So we have cells. You don't need to memorize all cells, but essentially have the macrophages, dendritic cells. The first three, essentially, I call them the eater cells. So they eat the microbe. That's what they do. That's their whole job. And then the term for that is phagocytosis. But the bottom line is they just eat it and eat it away to make sure it doesn't infect anything else. You have what's called the natural killer cells. What the natural killer cells do is they attach the cell. They can even attach to the cells that eat the microbe, and it destroys it because it's killer. It can also kill your own cells who've been infected with the microbe. So if you think about HIV, HIV infects your cells. So if the natural killer cells, they're trying to find it, if they know that the cell's HIV infected, it can kill it. The problem with HIV is that it's so smart, it can remain dormant, so the natural killer cells cannot see it. So when you fail this, the first step that it doesn't pick it up, that's when you have a lot of problems that come in. But essentially, there are two types of innate. You have skin barrier, the first barrier, and the cellular barrier, where you have two components: the killing cells and the eater cells. That's what you have in the innate immune system. This is just a graphical representation of what I'm talking about. So you have. It's good. So you have a microbe that gets through the epithelial barrier. That's essentially the skin barrier, the first barrier that we're talking about. It goes in there, and you have the phagocytes, which is the eater cells, that sees it and ingests it, and eats it up. So you have the NK cells, the natural killer cells, that's waiting to see which cells have the microbes and to kill it, to get rid of it from your body. That's what they're trying to do. So, not too bad. But then what happens when you have things that get escaped and you don't see it? So that's where you have the adaptive immune system that kicks in. So it kicks in, doesn't kick in right away. It's slow. It kicks in about 96 hours later, 4 to 5 days later. And what it does is generates lasting protective effect because your adaptive immune system has memory. So when we do vaccinations, we're trying to trigger that immune system. And the way it remembers is that every organism, everything that kind of comes into your body, a pathogen, they have what's called antigens. And what antigens are, they just think of it as name tags for each one microbe. And the adaptive immunity remembers, oh, I saw your tag before, so this time I'm going to attack you. So the next time you're exposed to the same organism, your adaptive immune system will kick in right away. So it doesn't take a long time. So your adaptive immune system is always evolving. It's unlimited. You have unlimited potential in your adaptive immune system. But sometimes it can go crazy too, and I'll tell you some of the diseases that can affect this. So in terms of adaptive immune system, you have two different players. So you have the helper T cells, which is there to recognize the microbe. And then you have what's called lymphocytes. And you're going to hear a lot about this when you talk to healthcare providers about, so it's B cell derived, T cell derived, especially, we're talking about rheumatoid arthritis and lupus or psoriatic arthritis. So B cells, all these lymphocytes, essentially come from your bone marrow. They're just immune cells that come from bone marrow. Very simply enough, they're called B cells because B cells, they mature or they become functional, they grow in the bone marrow. But some lymphocytes, they are developed in the bone marrow, but then they're released and they travel to the thymus. That's why it's called T cells. And they stay there and they wait to come into action. So in terms of B cells and T cells, it's not nothing too complicated. It's just where they are coming from. B, bone marrow, T, thymus. That's it. So what are the functions for each one? So the B cells essentially is what they make antibodies. So when I say about antibodies, you probably hear about a lot of the treatments out there. They're antibodies, monoclonal antibodies. Essentially, they're structures, they're substances that mimic your body's system to fight. So antibodies are produced by B lymphocytes, the B cells. So what happens when you have a microbe that escapes the innate immune system, the B lymphocytes or B cells come in and attach to it. And they go, ooh, what is this thing? So they start producing what's called antibodies, which is essentially a tag. The next time when they come in, the antibody just go and tags it. So what it does, when it tags these microorganisms, it's just telling your body, like, hey, this thing is tagged, please get rid of it. So things will come in and get rid of it. So B cells, they just produce antibodies. Antibodies is something you always hear. Treatments are a lot of treatments that you inject, usually, that are injectable, not oral. Injectable treatments are usually antibodies that you do, all right? How about T cells? T cells doesn't produce antibodies. T cells function very similar to killer cells. They don't kill cells, they just kill the microbes. So essentially you have a cell in the immune system, such as the eater cells. So they work together. So the eater cells will eat these microbes, and you break it down into its components. And what it will do is it will spit out parts of the microbe and give it to the helper T cells. The helper T cells will learn to see what are some of the signatures or name tags of these, like antigens for these microbes. And then once it learns it, it becomes the T cells, the mature T cells, or sometimes you can call it T killer cells. That's what they do. They don't tag anything. They just see the microbe, they'll kill it. That's what they do. They go straight to the microbe and kill it. So you have the B cells and T cells. They work in conjunction to fight, to fight any different ways. And sometimes when you have B cells, they have antibodies that put tags on the microorganisms. It allows helps the T killer cells to come and kill it. So it's one is tagging and one is killing. So that's your adaptive immune system. So just tying the both together, this is what I showed earlier. It's just to give you a sense of how quickly does anything kick in. So the first part is the innate immune system that I show you. It kicks in at 0 to 12 hours. That's the first thing that happens. Your body is fighting it. And that's when usually sometimes when you have an infection, you get a little bit of a fever and everything. And then your adaptive immune system starts learning. But it doesn't become functional until after 5 days, 4 or 5 days. But then the next time you feel you get the same infection, your adaptive immune system knows how to fight it. So if you think about how we get the flu vaccine, do you often hear, oh my God, we had the flu vaccine this year, but we got the wrong strain, and it doesn't work. That's because they had the wrong antigen, the name tag. They inject you with an organism that has the wrong tag. And that's a problem. Usually that's why when you do a flu vaccine, it's essentially a cocktail with different viruses with a different tag so that your body, and sometimes they forget one, or they didn't know one existed. So it's like, oops, people are still gonna get sick because you don't have it. So you don't have the adaptive immune system that fights the one that hasn't tagged. But your body eventually will be able to fight those with the innate and adapted. Over time you become immune to it, of course. So another thing I want to throw in here is cytokines. You're like, oh my God, Jennifer, stop talking. What is this? So cytokines is important because when you talk to this, especially talk about rheumatoid arthritis, you hear about TNFs, right? You hear a lot about TNFs, anti-TNFs. What are TNFs? Or you hear there's a drug that targets something called IL-6 interleukin. You're just like, what? Jenny, you just talk about B cell, T cells, now you're talking about cytokines? But yeah, a lot of drugs target cytokines. What is cytokines? I want you to think of cytokines as a language that cells use to talk to each other. So for example, the innate immune cells, when they need to tell the adaptive immune cells to come and help me out, they need to produce cytokines to tell them, come over here, we need more help. Or innate immune cells can release cytokines to talk to other innate immune cells to help out. So some of the cytokines are associated with the innate immune system, is like the TNFs that we see. That's huge in terms of the most treatments available right now that are what's called the anti-TNFs, and they're one of the oldest as well. Or you can have some of the ones that are associated with adaptive immune system. And this is what happens. So this is an example of what happens. You have the pink little lines, they're microbes or bacteria. So you have the eater cells that come in, you have a little bacteria, I'm gonna eat it up. But you realize that we have a lot of infection. I can't take care of this by myself. So it's going to produce cytokines or chemokines, essentially that's the language, telling the body, telling the blood system, I need more support. Bring out more macrophages, bring out more eater cells. So what it'll do is like, okay, it gets that signal like cytokines, we need more help. So it starts releasing additional eater cells. So what happens when you have additional eater cells? So when we get inflammation, let's say you get a cut, because it's being pushed by the blood system, you get the swelling, right? You get the redness. That's what happened because it's pushing all the immune cells to that site to attack it. So that's what's happening when you have, but you have the cytokines. But sometimes what happens is the inflammation system gets so crazy, is talking too much. It's essentially like screaming. It's like, shut up, scream. But if we scream too much, you cause damage because it's like causing damage to your hearing, right? So too much of something is not good. Just remember that. Too much cytokines. So a lot of autoimmune diseases is because of an overproduction of cytokines. Too much being produced, all right? So the take-home message after all that is just remember the basic difference between innate and adapted. Innate is what you're born with, the first thing. But the adapted, just remember, it's very specific to each microorganism, and it's smart, and it remembers the next time you have it. All right? How do you feel? You good? You sleepy yet? No. All right. Now let's go to autoimmune disease. So what is autoimmune disease? I love this picture because the cat is seeing something different, right? So it occurs when the body's own immune system, when your own cells cannot tell itself from the others. Just like, I see it, it's me, but it's not me. What is that? I want to get rid of it, right? So I always want to say like multiple personality disorder. That's what's happening. And this is some interesting numbers. It says about 6 to 8% of adults are affected with autoimmune disease. But the NIH, they're about over 80. I think there's more than 80 diseases that are associated with autoimmune disease. But the NIH, the National Institutes of Health, only recognizes about 20 to 30. Why is that? Because they don't know what the causes of the others, and there's no treatment. So they don't want to talk about it. Like, let's just talk about the ones we know. But if you look at the widespread of a lot of diseases, we have a lot of them. Interestingly, mostly women are affected by a lot of these diseases, and I'll tell you a little bit of why. And there's another useless information I like to provide because it's interesting, is left-handed individuals. I didn't know about this until I put this presentation together and I was doing the research. It seems that left-handed individuals are more affected by autoimmune disease. 11% versus 4% in the right-handed. That's pretty interesting number. Why? We don't know. But it's hypothesized that it's due to some internal system, endocrine system that happen when you're a fetus in your mother's womb. But they don't know why. But this is just some interesting statistics. Any left-handed people here? Yeah. Doesn't mean that you're gonna get, I don't mean it like that. I'm just saying. Another useless information from Jenny, right? All right. So what do these numbers mean? Like, we always, when you go to talks, it's like 6 to 8%. So what is that? Is that a lot? Is that little? I always hear percentage, and I'm sitting there going, how much is that? So let's put it into perspective. And these are straight quotes. So many individuals with autoimmune disease, let's say 8% of the United States population, we're talking about 24 million people that are affected by autoimmune disease. 24 million. And you go, how much is that? I don't know, right? That seems a lot. It's like whole New York population, right? New York City. Let's put it into context. We hear a lot about cancer. Cancer is one of those things we hear all the time because it's so deadly, right? And there's so many issues. 9 million people are affected by cancer. 9 versus 24. Less than half are affected by autoimmune disease. Now let's put something that we hear about all the time, heart disease. 22 million people are affected by heart disease. So do you get a perspective of how prevalent autoimmune disease is? It's big. So, and then what a lot of people know is that autoimmune disease is the third leading cause of morbidity and mortality after heart disease and cancer. So it is something that's very, very important for us to be aware of and to continue research, and there's a lot more we need to find out about. And NIH needs to, they acknowledge it, but there's so many things about immunology that's really difficult to pinpoint. That's why we have so many challenges in this field. So the development of autoimmune disease, like I mentioned before, occurs when your system cannot distinguish self from non-self. There's also something about pathogens called composition mimicry, or what they call molecular mimicry. So pathogens are smart, because when they get into your system, what they want to do is to avoid being killed, because they want to infect you. So they do mimicry, because they know your system, so they start producing antigens that are very similar to your own self tags. So they try to pretend that it's one of your cells. And then but sometimes your immune system goes, no, don't trick me like that, because I know you're similar to me, but you aren't me, I'm still going to kill you. But what happens to that? It can't distinguish itself anymore, because next time you see something that's yours, like, maybe you're tricking me again, I'm just going to kill you. So that's why, when you have the molecular mimicry, it can cause some of the haywire that happens with autoimmune disease. And then a lot of the results from this autoimmune treatment or the autoimmune diseases is it causes hypersensitivity, like allergies, sneezing, everything, and then inflammation. And it can lead to a lot of other issues such as tissue degeneration or damage. So what are the tissues that can be affected by autoimmune disease? It can be affected in the thyroid, such as Hashimoto's or Graves' disease, which is goiter. Have you seen the people who have like this balloon? So that's an autoimmune disease as well. So in terms of the brain, you can have your own cells attacking your brain cells. Multiple sclerosis is a huge problem. That's an autoimmune disease. That's caused by, there are some people who say it's caused by TNF, overexpression of TNF that attacks its own cells. So we talk about bones. That's what we hear about, because this is rheumatology. Rheumatoid arthritis, ankylosing spondylitis, it's all part of the autoimmune disease family. It can affect muscles. So this is up for debate. Fibromyalgia, not sure. Fibromyalgia is one of those diseases that you can't really pinpoint, but there's some evidence that it can be caused by some of your autoimmune disease going haywire. It can affect the muscles. It can be Crohn's disease. You heard about Crohn's disease? That's also autoimmune disease. It's essentially your own cells attacking the lining of your intestines in this case. And it can be affecting the blood. So autoimmune diseases can be very tissue specific, the brain, the joints, the intestinal tracts, or it can be widespread. That's when you have autoimmune disease against your blood, your own red blood cells. When you have autoimmune disease against your red blood cells, it can affect different organs in your body. So that's pretty, I want to call it universal, very widespread, and it's hard to control that sometimes. And one of the diseases that affects worldwide, that affects your red blood cells, is systemic lupus. We hear about that. So that's a very widespread. So what causes autoimmune disease? So usually a lot of triggers for some psoriatic arthritis, usually triggered by some sort of external stress that comes in. Either a lot of patients I've talked to, or like with the physicians I worked with, is usually it comes up when there's something happens in their life, something tragic or something very big that happened in their life, and they're stressed. And it seems that when you have a lot of stress, your immune system just goes a little bit out of whack, as I call it. And it can be caused by drug chemicals, sunlight. Skin cancer is destruction by the UV light by destroying some of your immune cells. That's where it's coming from. But there's another component with the yellow one, which is genetic. So when you have something, you want to think about, or when you have a friend has something, you want to think about family. So oftentimes there's some diseases that are passed on from grandma to parents. So sometimes there's some things like, for example, psoriasis, you have parents have it. There's likelihood you have. So it's very important to go through your family tree. Like, what's going on? Maybe you have a genetics thing that's associated with your immune system. Female, like I said earlier, female seems to be more affected. Why is that? There's more hormonal changes in female. I am not talking about PMS, all right? So get that out of the mind. But there are more hormonal changes. Some of the sex chromosomes in the female is slightly different. That might be causing some of the autoimmune disease that are more affecting women more than anything else. And then some factors we don't know. It just happens. We really don't know. And there's a lot to look at. So this is just a little breakdown. The red lines is for females and blue is for males. If you like Sjogren's syndrome, essentially it's like really dry mouth and can cause a lot of problems. It affects women so much more. If you look at systemic lupus, women, right? Rheumatoid arthritis is 2-to-1 happening to women versus men. I'm gonna let that sink in a little bit. So multiple sclerosis, women. Psoriasis is kind of even. 1-to-1, right? And then you get to ankylosing spondylitis, young men get more, all right? Don't we women have enough problems already, right? I have to deal with this. What's going on, right? So men don't complain, I'm kidding. I just thought this was a very interesting aspect of it. Just, think about it, maybe hormones, something, what's going on? Maybe we have more stress, right? Because we have to do more work than men. Kidding. But these are the stages of autoimmune disease. Why is autoimmune disease so difficult to diagnose? Because oftentimes, you have the healthy individuals, and we usually stay in the yellow part, where you have some autoimmune reaction, allergies, right? It just stays in that part. But we treat that part with over-the-counters. We can control it. And we stay in that area for 5 to 10 years, for quite a while. That's and everything. Then you go to the pre-symptomatic phase. You don't feel anything, but your immune system is still going, it's developing some of the problems. But we don't know about it because we don't feel it. And that's why you can't diagnose this until sometimes when it gets really bad, because the first time you start going to see a doctor is to see potential disease that could be autoimmune is when you have some symptoms. What kind of symptoms am I talking about? Think about fatigue. Fatigue is one of them. Chronic pain, chronic pain, sleeplessness. Something just like doesn't feel right. How often do you go to a professional and they say there's nothing wrong with you? It's all in your mind, right? And it's true. I mean, it's nobody's fault because there's no way to diagnose it unless you understand a little bit about family history. So it's important to go back to your family history to see, is there anything in my family history that I need to know about? Because then you need to share that with your healthcare provider so they can know, because there's nothing else they can do to diagnose. So oftentimes in the first doctor's visit, nothing comes out of it. It's like, you're fine, everything looks fine. Maybe it's just in your mind, And I hear that all the time. I have my aunt that she had fibromyalgia for long years before they thought it was fibromyalgia, and they thought she was crazy, because she was in pain. She was always in pain, and even my uncle thought she was crazy, So it's one of those things. So it's just go back to your history, just think about it. Call someone, ask, anybody in the family has that? This is not just the parents, but your cousin, something, just figure that out. But unfortunately, most of the diagnosis occurs when you have an irreversible damage already happened. Because that's when they go, oh, damn, I didn't know you had that, but now you have organ damage. And at that time is, you have some damage. If you find out earlier, you can prevent further damage and you can still be functional. But sometimes, when it's, in the U.S. we have pretty good, healthcare system. I would like to think we have very good doctors that can do it. But if you look at a lot of the developing countries, they don't have a lot of the knowledge or access to it. And you see a lot of deformities that come with it because they can't treat it, or they don't know how to treat it, or they don't know where it came from. So, and that's one of the issues that we need to, even as a company, that's what we need to find ways to diagnose early treat the symptoms before even they appear. So, and then some of the examples of autoimmune disease: psoriatic arthritis, rheumatoid arthritis, ankylosing systemic lupus. So the first four is a lot in terms of the rheumatology world. So you have multiple sclerosis, like I said. Type 1 diabetes is an autoimmune disease. If you think about type 1 diabetes happens when your immune cells attacks your pancreas and attacks the cells that produce insulin. So that's what happens too. So it's one of the biggest ones, but you don't think of type 1 diabetes as an autoimmune disease, do you? Just like, something's wrong. But it's just that your cells hurting your own cells that are producing insulin. That's why they can no longer produce insulin at that time. So this is what happens in psoriatic arthritis, for example. You have some external factor, can be infection, trauma, some stress that leads the kind of haywire response into your system, or you can have genetic factors. So your immune cells start producing B cells, T cells. It can be, at the adaptive immune level. It can be at the innate immune level by producing overproduction of macrophages, or dendritic cell, which is the eater cells. And what they do is they start producing cytokines. Those language that they use, they start screaming. And that's when you have that inflammation and the pain. So the reason I show a lot of different cells that are associated with it is because how often do you hear the doctors put you on a treatment and it doesn't work? And they go, let me put you on another treatment, because a lot of the some treatments treat the same pathway, targets the same cells, but different treatments that we have targets different immune cells. So perhaps your disease is more macrophage derived, more B cell derived, T cell derived. So usually it's hard to tell until you start trying out some of the different treatments. You can be doing some holistic approach to figure out what it is. So there's some drugs that just don't work, and then I always get questions by anybody, how come it doesn't work for me? Maybe your etiology, the origins of your disease is a little different. Maybe it's not targeted by this drug. Try to do research to see what others are out there, or any other way, talk to your healthcare provider to see how you can fight it. So what do I talk about? What do I mean? So when you have this overproduction of cells, if you look at the rheumatoid arthritis, this is when you have degeneration happening. So in the rheumatoid arthritis, you have also overproduction of the T cells, B cell macrophages, and some of the cytokines. So these immune cells essentially attacking your own tissue. They're attacking your bones, attacking your synovial fluid, which is the area where your bones, your joints come together. So you start eating away. So you still have that destruction, eating away the bone. So when you get to that point, if you can potentially slow down the development. But usually this is, unfortunately, a lot of times this is when you get diagnosed. Like, they do the X-ray. Oops, your joints. But but sometimes, if you talk about developing countries and you have fingers that are kind of twisted, it's just, or like weird hand things. It's eating away too much that you can't do anything. And sometimes people lose function of their hands because they just can't do it. And my uncle has rheumatoid arthritis, and he has no function of his hands. So it's because where he's from, you know, the healthcare in his era was they didn't understand what it was. So he never got treated. So he passed away a few years ago, but you know, was a lot of complications. But his hands essentially was always like this, and he could barely, you know, hold force or anything. So it's really important to, you know, figure out a way to treat this early on, any autoimmune disease. And then just like I said, systemic lupus, it can affect many different organs because essentially your body producing antibodies, like I said before, by the B cells, it's very B cell derived. It's producing antibodies against your red blood cells. So essentially telling your body to destroy your red blood cells, like, oh, this is not mine, just tag it, get rid of it. So red blood cells is all over our body, travels everywhere. So in a systemic lupus, it can affect many. You know, you usually get a little, early on, you get a little flushing of the face, you know, some rashes in the face. It can affect your kidneys. It can lead to renal failure. It can cause heart disease. So it can affect many different organs because this is what's called systemic rather than tissue specific. All right? And then in summary, so this is the concept of immunity, as we know, is an ancient one. So the study of immunology didn't come about until HIV came. We understood a little bit about HIV, human immune deficiency virus. Its immunity is extremely important, but it can cause problems too, you know, when it cannot distinguish itself. And you know, it's so heterogeneous. We don't know what the origins are and everything. And then autoimmune disease, you know, interesting, is called a disease of the industrialized world. And what do I mean by that? If you think about Crohn's disease and things like some of the skin diseases, eczema, it seems to happen a lot in industrialized world. If you think about eczema, think about Japanese people. This is a real fact. They tend to get sick easier because when they're in Japan, they're so clean, right? They're always like clean everything. So their body, you know, your adaptive immune system hasn't seen very many things. It doesn't know how to kick in because it hasn't seen a lot of the foreign pathogens. So when they go somewhere else, that kind of more developing country, they just get sick because it's just your immune system trying to fight. It's like, what is this that you're introducing me to? So a lot of autoimmune disease, they call it disease of the industrialized world. Crohn's disease happens more in rich countries than anything. China is having an increase in Crohn's disease because their diet is getting a little more fatty, right? They have the burgers, they love it, and they're getting Crohn's disease. So it's the industrialized world. You don't see Crohn's disease a lot in places like India, right? So if you think about it, it's really interesting. Something about industrialized world that we do, you know, we do a lot of, I don't know whether it is or not, but it's just, Jenny, don't quote me, is maybe processed food. Is it causing something, you know, inflammation? It is. Processed food we know causes inflammatory processes. And then that's what it's doing. And that's why we have autoimmune disease. They always call it in the industrialized world disease. So what I gave you today is just a very small glimpse of what immunology is about. That's why there's a whole degree for it. I've been doing research on 15 years, and I still learn something new every day. And this is the reason why it's so challenging. You know, I gave you a very tiny little glimpse, but immunology, immune system is not a linear, it's a cyclical type of system, and it needs to be in balance. And once it's out of balance, that's when problems come. So just remember, I hope this will help you when you're out there talking about it, when you're reading about it, and gives you a little glimpse of understanding what your immune system, and ask the right questions when you're out there. You know, think about it, right? And you can talk to me anyway. You know, if you have any questions, let me know. And I'm glad that nobody fell asleep. Thank you. Any questions or anything? All right. Thank you. Oh, yes.
Yeah, I have a question when you were talking about in the beginning about the immune system.
Mm-hmm.
Tissue repair, regeneration, and the term clearance. I didn't really understand that.
So clearance, yes. So when you have tissue, you know, let's say you get surgery, right? And you see scar tissue. Usually it needs to, when you're healing, have scar tissue, your system will get rid of it. Or the way it gets rid of it is it's very molecular, like microorganism, very tiny, kind of breaks it down so that the blood can take it away and release it and destroys it in the cell. So it kind of makes it disappear, makes it smaller and smaller and smaller so it disappears. But when it doesn't do a good job, that's when you have tissue damage, like scar tissue. Like when sometimes you have surgery and you touch something, it's like, what is this hard thing that's not going away? It's scar tissue. That's why some of the things that after your surgery, you want to do some of the physical therapy, try to get rid of that scar tissue, because it can help the when you do it and push it, it helps the immune system come and clear out, because you're adding a little bit of stress for the immune system to come and clear out, essentially to break it down so they can be gotten rid of. Mm-hmm. You're welcome. Yes.
I know later today there's going to be a discussion about treating pain and stuff like that, but do you have any recommendations on how to prevent rheumatoid arthritis from worsening the symptoms, the pain, managing those kinds of things?
So I'm not a physician. I'm a scientist. So usually I do it with that, and I'll refer to a physician for that, because I don't want to be providing you medical advice, because I'm not qualified that. I can tell you all about molecular biology. But one of the unfortunate things about rheumatoid arthritis is it is really hard to diagnose. So people usually start with chronic pain, and you miss it, right? Because you don't know what's happening. And then early on with the rheumatoid arthritis, essentially is when you start feeling pain, maybe your joints aren't damaged yet, so you don't know. So some of the first treatments for rheumatoid arthritis for the pain is called the non-steroidal, the NSAIDs, like the ibuprofens and everything. But Dr. Shibuya talked a little bit about some of the holistic approaches that you can do. I mean, essentially, there are a lot of diseases, like one of the biggest ones, such as psoriasis, like skin, they always talk about, use a lot of drugs. But, there's studies that, in psoriasis, if you clean up the diet, and if you get a lot of the psoriasis patients have more obesity, there's really clear studies that when you clean up your diet and you lose weight, your skin gets better. So there's something that it's not everything let's go to the drug. It's not, And I work for a drug company. They don't want to hear that, but it's true. Not everything is drug, right? But it's true. There's something that you can do about it. And then I think Dr. Shibuya will be able to provide you with that. Mm-hmm. Yes. Anything else? Don't say that about the drug, because I can get in trouble. Just kidding. All right. Thank you very much.
Thank you.